This is the time of year that the holidays are approaching. Most people look forward to them. Breaks from school, break from work, time off, time with friends and family. As a nurse who works at a hospital with an emergency room, these are the times of year during the holidays that we tend to see more alcohol-related instances. There are more patients in the hospital due to alcohol poisoning, motor vehicle accidents, so be it. Alcohol poisoning is a very real and a very serious issue that unfortunately we deal with quite often in the emergency room, and not sure why, but it does seem like this time of year is more prevalent than others. Whether it be tailgating, time spent at home with friends and family, or, like I said, breaks from school and friends are all just hanging out. Alcohol poisoning is the result of ingesting so much alcohol that the body is actually poisoned by it. Approximately 50,000 people in the U.S. are diagnosed with alcohol poisoning every year. There are celebrities. Amy Winehouse, singer, she died at age of 27. Bon Scott, the lead singer of AC/DC from 1974 to 1980, died at 33. Keith Whitley, country singer, died at 34, all from alcohol poisoning. According to the Emergency Medicine 6th edition, there is no level of blood alcohol that can be defined as true alcohol poisoning. It is based on, which that is due to tolerance levels, the rate of ingestion, and things like that. Like you can have a blood alcohol level of a certain percent for a DUI, but not so much for alcohol poisoning. A few signs and symptoms to look for, according to MayoClinic.com, of alcohol poisoning include confusion, stupor, vomiting, seizures, slow breaths, which would be less than 8 breaths a minute, irregular breathing, which would be what we call like apnea, which would be a gap of more than 10 seconds between breaths, blue-tinged or pale skin, low body temperature, and unconsciousness, or what many people term as passed out, and not being able to be aroused. Alcohol poisoning needs to be treated in a hospital area. It's treated through careful monitoring, through cardiac monitors, observation of airway, oxygen therapy. There are also fluids given intravenously to help prevent dehydration. Again, according to the Emergency Medicine book, 6th edition, thiamine is a standard treatment therapy with all alcohol poisonings. Other vitamins and glucose management are used if indicated from labs and tests that are ran on the patient. Some people are under the impression that certain home remedies can help with the sobering up process. These include black coffee, a cold shower, food, or sleeping it off. In reality, the shock of a cold shower could lead you to loss of consciousness. Sleeping it off is also a very false thought. In cases of alcohol poisoning, alcohol depresses the nerves that control our involuntary actions, such as breathing and gag reflex. The gag reflex works to help to prevent choking, and an alcohol poisoning level of alcohol in your system can stop these functions. It is common for someone who has drank too much alcohol to vomit, which presents the danger of choking. This is increased with a person who is unconscious due to alcohol intoxication because they no longer have the gag reflex to be able to vomit and get it out. The blood alcohol will continue to increase even though a person has passed out. What the body has ingested will continue to be absorbed in the stomach and intestines, and so sleeping it off doesn't necessarily mean that they are in a good place. Dr. Henson, the medical director of Eagle Med Flight Services, states that you can speed up the alcohol intoxication process, but not the sobering process. In general, a person can metabolize approximately 1 beer an hour. So, due to the danger of asphyxiation, anyone who is suspected to have alcohol poisoning should be placed onto their side to help with the vomiting process. The consequences of alcohol poisoning, the obvious being death, the most severe, but there's also a chance of irreversible brain damage. Just remember that there are many responsibilities that go along with drinking, not just having a designated driver, but knowing your limits, being safe, and if you are in a position where you have a friend or are with someone who you suspect to have alcohol poisoning, never leave them alone, call for help. And that's it.